Healthy teeth in your mouth stimulate the jawbone through daily activities such as eating and chewing. When it is necessary to remove a tooth and it is not replaced, the bone at that site and the adjacent teeth are at greater risk for bone loss. This can make later tooth restoration difficult. Bone grafting allows us to restore bone that has been lost and even prevent future bone loss. Socket preservation is performed after a tooth is extracted to restore a single tooth site to prepare the area for dental implants. Bone grafting is also common when teeth are missing in the back of your mouth near the sinuses. A sinus lift procedure can increase the amount of bone available for successful dental implant placement. These techniques have allowed many patients who were once told they are not candidates for dental implants to successfully restore missing teeth. If you are considering dental implants, our team will assess the condition of your bone and develop a treatment plan to restore your oral health and smile.